My name is Capri Scott, and today I'm going to talk to you about starting an IV and why people need IVs. I will not go through all of the steps on actually doing the IV. I will just show you the items that are used to start one and tell you reasons why people need IVs. So, in this world today, people get sick all the time. Sometimes they have to call the ambulance to get them to the hospital for whatever reason. But usually, when a person comes into the emergency room or if they are picked up by an ambulance, an IV is started. The IV is started because certain medications or fluids may need to be given in order to get the person's body back to their normal functioning state. So, once the person is picked up, the first thing is to establish that IV line to make sure that they have the access to give medication to them. Things that are used to start an IV. First, the person must always have a pair of gloves. So you need to have a pair of gloves to protect yourself from yourself and the patient because bodily fluids can be dangerous. We treat every person the same, and you treat every person as if they're sick, and they should also, treat you as if you're sick. So you're protecting both you and the patient. You will also need a packet which includes, I don't know if you can see it really clear, but there's a tourniquet inside, a gauze, some tape, a chlorhexidine. Let me get it together 1 minute. But there's a chlorhexidine scrub to clean the skin, and then there's a label to put over the IV. Now, most times we use anywhere between 18 to 22 gauge. This is a 20 gauge IV start set is what is used. And once the line is established, we do what is called a flush with normal saline solution to make sure that the line is patent. People use IVs for many different reasons. Some may need fluids because they're dehydrated. Some people may need to receive blood because their blood count is low, or they went into a surgery or something, or they may even need medication. Very seldom do we just start IVs for no reason. Actually, IVs are never started for no reason. There's always a reason behind having an IV. Anytime emergencies happen, things need to get done. So that's why we make sure that there is an accessible way to get important medication to people when they are sick. People who need blood for surgery. Say you're in the middle of the surgery and you're losing blood too much. The surgeon will then, call the blood bank and have them deliver the blood, which is also verified by 2 or 3 people to make sure that the blood type matches and that the correct type of blood is being given to the patient. Also, medication is another thing that IVs are used for. People who have infections, sepsis, something of that sort will receive medication by IV. What's given through that IV is potent medication, very strong antibiotics, which cannot be given by mouth. And it is used to ratify the infection that's raging through the body. The attempt is to clear the infection so that the person will get better and get better sooner. Also, we use an IV just to deliver fluids to the body. Sometimes people don't drink enough water. Sometimes they don't drink, they don't keep up with the normal body fluids that we usually have to drink on a daily basis. They get dehydrated and they need fluids to return their body to a normal state. So, in conclusion, those are some reasons why we use IVs and what is needed to start an IV. Thank you, and you have a good evening.